Let's talk about why HSPs have to be super mindful and very careful when taking psychedelics. Hi, I'm Ashton, HSP psychotherapist, HSP myself, and helping other HSPs live a life they love. Now, of course, I have to say a disclaimer. Please do not take psychedelics unless you are in a state in which they are legal or a country in which they are legal and without the help of a trained specialist. Okay, so I'm going to tell you a story about when I was in a clinical trial using psilocybin, which is the active ingredient in magic mushrooms, for cancer patients to alleviate anxiety. The test was to see if psilocybin would help alleviate symptoms of depression and anxiety in cancer patients. Okay, but before I get to the story, which is quite a doozy, I want to give you a little bit of the science behind psychedelics. So psychedelics work mainly in the nervous system and particularly in the brain. And the way that they have an effect is by altering our neurotransmitters and the usual way that the brain works, altering brain activity, specifically serotonin, dopamine, and acetylcholine. Okay, so what does that have to do with HSPs? Well, we already know that we have very sensitive nervous systems, and we actually have a genetic variation connected to serotonin that can lead to lower levels of serotonin, not necessarily causing depression. However, there is an increased risk of depression in HSPs due to this genetic variation if childhood was difficult. Okay, so HSPs, most of us, when it comes to medicines or substances, caffeine, alcohol, the effects on us are amplified because we do have such a sensitive nervous system. So like for me, for example, I have to take the baby dose of a medicine. If I take Benadryl, which is very rare because of the effects on me, I'll take a dose of baby Benadryl. Or I'll take a half of a, ibuprofen. They say take two, I'll take one. I drink decaffeinated coffee because I can just be so jittery and anxious if I drink coffee. So same goes for basically anything, any substance that we're going to put into our body. And psychedelics are no exception. So I was in a clinical trial about 2 years ago using psilocybin to determine the effects on reducing depression and anxiety with cancer patients who were potentially facing death. And, sadly to say that there were many or some of my colleagues or cohort participants in this trial who have died since the trial. So the thing with trials or even medicine, right? These doses are standardized. That's why they call it a standardized dose for the average person. And I mean, what average even means is beyond me. I don't know. Because there is no such thing. And then when you take an HSP, it's like, wow, you're going to give the same dose that you would give to, let's say, a 200-pound male non-HSP to a 120-pound HSP female, and the difference is going to be night and day. So I was given the same dose as all of the participants and all of the cohorts in this trial. And I was greatly affected, to say the least, by this plant medicine. I'm going to call it plant medicine because that's what it is. It's the clinical trials are standardizing it, and that's great to make it more mainstream. And there's definitely some benefit to it. And traditionally in indigenous cultures, psychedelics are considered plant medicine, and they are used in ceremony, and there's a very spiritual component to it. So the plant medicine during this trial was way too strong for me, and my experience was particularly problematic and traumatic, I would say. For the first 3 hours, I was basically in terror and panic because the medicine was just too strong. It was affecting my brain and my consciousness too strongly to be able to let go, which is really the point with psychedelics, is to get all that brain, get your analytical mind out of the way and be able to surrender and let go. And when it's that strong, it's really, really, really challenging to do that. So I did make it through the trial because I'm here to tell you about it. And the results of the trial, several weeks later, once my body was able to recover, because it did take a couple of weeks to recover, the results were life-changing, actually. And the study results were just published, and they were favorable for psilocybin reducing anxiety and depression in cancer patients. So it's really phenomenal work. That Sunstone Therapies is the name of the institution that's performing these clinical trials, and the folks over there are just amazing. So again, please do not use psilocybin or any other psychedelic unless it's in a supervised clinical trial or in a state or country in which is legal. And please have somebody who's trained to help you, because these medicines are powerful. They're powerful, and they are very effective. So HSPs, if you're going to work on expanding that consciousness, we already know we have more activation in the insula. That's the part of the brain that is often dubbed the seat of consciousness. Please be mindful about your dosage. Go start out slow and low. It's better to start out with a lower dose, and if you need a booster later on, you can do that rather than having too much right out of the gate. So I hope that helps for any of you HSPs desiring to expand your consciousness with the help of plant medicine. And remember, when you understand your sensitivity, you can claim it as your greatest asset, and you too can live a life you love. See you next time.